Hi, Success MP. It's your host, Sandra. We are joined today by Dr. Nykkia Sellers. She is a board-certified nurse practitioner with an extensive background in endocrinology and chronic disease management. She specializes in adult endocrinology and focuses on diabetes management. She's a certified diabetes care and educational specialist and is board certified in advanced diabetes management. She's the founder and owner of the Diabetes Care and Wellness, a private endocrine practice based in Arkansas. And she has been instrumental in creating and implementing diabetes awareness and educational programs in the Mid-South area. She has a DNP from the University of South Alabama, and she received a bachelor's in science and a master's in nursing from the Arkansas State University. And we are so happy to have her on the podcast. Welcome,
Thank
Dr.
you so
Sellers.
much. Thank you so much. Thank you for having me.
Yeah, I'm so excited to talk about diabetes, man. I think that is such an interesting topic. I had gestational diabetes with my first baby, and so I kind of started to get into it and try to understand it. So I really I love this area of medicine. So tell
do
me,
I.
tell me a little bit about your background in
Okay.
your specialization. What made you specialize in diabetes care?
Okay. So as far as my background, starting out as a nurse, I did internal medicine or med surge at the time. That's what we were doing, med surge. And then I went to like a neuro background. When I was in high school, let me take it back to that. I knew that I wanted to be a nurse practitioner. I went on and was different various roles as RN. And then when I went back to NP school, I worked in internal medicine. I knew that I didn't want to do anything far as with pediatrics or anything. So I kind of loved managing like chronic disease and those chronic disease states and taking care of the older population. So from internal medicine, and then I went to become a hospitalist in a acute care setting. Then I went back to a family practice setting. And so I told them, I was like, well, I know it's family practice, but I want to see like if I see any kids, let them be 13 and older or something like that. So at that time in that practice, it was I think 2 physicians and 3 nurse practitioners, and they would always send me their patients with diabetes. They were like, "You are a diabetes expert," and I'm like, "I am." So I didn't know it, you know. That's what I always tell people. Sometimes people will speak life into you, and you don't even know it.
I like
Uh,
that.
so when they told me I was their diabetes expert, I'm like, okay, well, maybe let me try and take this certification. So I took diabetes education. It was a CDE then, certified diabetes educator exam, passed that. And so then I began my journey in diabetes. There was a job opening that came. I knew the chief nursing officer of this hospital. She was like, you need to come talk to our CEO. And so they're starting this new diabetes wellness center. You would be great for it. And again, I was like, I would be. And so that started my love for diabetes. Well, I don't know if it started the love, but it definitely started the practice with diabetes, just solely diabetes.
I like that. I like how you said that they spoke life into you, because one of the things you learn, and as you're starting to figure out what am I good at, is by
Right.
other people kind of speaking this into you. And
Yes.
sometimes you have to listen to what other people are saying to be like, oh, wait, maybe I am good at this. Like maybe I
Right.
do have a heart for this that I didn't even recognize in myself.
Right.
I
So
think
I
that's a
always
really
try
good advice.
Yeah,
Yeah.
and I always try to tell nurses and nurse practitioners, we need to make sure that we are telling our colleagues these different things. You never know who you're going to pour into and be the next great provider. So,
Yeah, that's good. So then what made you take the leap? Because working with the CNO and working in the big hospital setting, that's one thing. But now you're kind of doing your own thing, which
yeah.
is a whole nother beast. So tell me a little bit about what got you started there.
So that's a little different. So when I was at it was acute, it wasn't acute care, but it was affiliated with the hospital. So the diabetes center was outpatient. So I would see different people with diabetes from the community and also patients from the hospital. They would be discharged. They would refer patients there. So I worked there for some time and then COVID hit. So when COVID hit, I would work 1 week on and 1 week off. And so then it was 2020. Then I had some health issues myself at the end of the year. And so fast forward, I was no longer working there. Once I felt like I was ready to get back into the work environment and everything, I took a job part-time because I just wanted to see how it would do at an endocrine office. It was a private endocrine office. And so I hated it. When I tell you I hated it, the
You know what I was
provider,
expecting right
yeah,
there,
I
but definitely
hated
not.
it.
I hated it.
I
Love.
did.
Hate, 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 love.
I strongly disliked it. Let me
Yeah, yeah,
say
yeah.
that. So
Yeah.
hate is not a nice
Okay,
word. I
that's
tell
good.
my
That's good.
son, don't
Yeah,
say
that's
hate.
good.
I
Yeah, yeah, yeah.
strongly dislike being there. So from then, I think I was thinking, I could do this on my own, like, because at the center, I was doing it on my own. I was used to doing all the things, taking care of patients and everything. And so I went to the private practice. Again, I did not like it because
It's not to my liking.
it
Yeah.
was not. Loved the patients. The patients were great. I loved what I would do, but it was just very different. I got to the point where I was like, I'm going to do this on my own.
Come
Never
on.
had any desire to do that. Never had a desire. I wanted to always go and get my guaranteed check every 2
Yeah.
weeks. I know that this is some place that God wanted me to be to help people because I've always worked in like a bigger area like Memphis in Tennessee, but my practice is in Arkansas, which is right across the bridge in West Memphis. And the people in that area, they did not rather have anyone that specialized in diabetes. They would have to go back across the bridge to Memphis or travel like an hour to another city to receive specialized care. So I
Wow.
think I answered your question.
Yeah, no, you did. Well, like, it sounds like you were able to parse through what it was that you weren't enjoying about taking care of patients at that practice. And so you took out the part that you didn't enjoy, which was the admin part that you were struggling with at that practice, and then kind of put yourself as like well, maybe a better question is, was it just how the practice was run was something that
Yes.
was kind of where, yeah. So like,
Yes.
that's what I was thinking. Like the way that the
Yeah.
admin was working was just like, this doesn't work for me. And
Yes.
seeing the need, which is another thing I talk about on this podcast, is like finding the gaps in healthcare and filling the gap, right? As much as we like to think some of this stuff comes divinely and we just are anointed with this thing that we're going to go and do, sometimes we have to notice what's missing and then we go fill it. It's not glamorous. It's just, this is operational. This is what we need to do in order to make money. And it's a good business plan. Like
Yeah.
there's nothing wrong with that, right? Like that's called wisdom. It's going, hey, listen, this community needs somebody to help with diabetes management. I'm not enjoying this. Could I maybe give this a try? Could I maybe bet on, I bet on myself? I think that's really neat. And yes, you did answer that question. And the role of the nurse practitioner in managing diabetes care looks like what? So your practice and what is it that you bring uniquely to the space that you're in Arkansas?
And I think that had a lot to do with why I wanted to do or start my own practice because I wanted to be able to take the time with patients and explain to them exactly what's going on. And also with that educator piece of it, not only being their provider with managing their diabetes, but also educating them on why they're taking this medication, what diabetes does to or can do to the body.
Mm.
You know, if you get into this situation, if your blood sugar drops low, I wanted to be able to take that time with my patients, let them know I'm here for you, let you know if you have any questions, you can call me or let's sit down and talk through this. Or, if there's something that I feel like may be better for your health, let's discuss this together. So I feel like that's part of the reason for leaving that other practice and starting on my own is because I wanted to really have that kind of like more one-on-one with the patient and taking the time because diabetes, once you hear that, even with gestational, because I had gestational diabetes as well. And even when you hear that, you're kind of like, okay, this is right, right. When I heard, I was like, this can't be true. Then I got to think, I was like, this is what my patients feel like, when they go through, checking their blood sugars and things like that and having to eat differently. I was like, okay, this is what my patients go through, even though, I felt like I was there for my patients, but when I got that diagnosis, I was like, okay, I kind of was more like, okay, it's not easy. And I knew it was not, with any chronic disease, it's not easy to hear. And
Or
so
to manage,
to
right? Like you just said, like
to
pricking your
manage.
fingers and like
Yeah.
all this different things that we have to do as diabetic moms. And there's shame. There's like,
Yes.
oh, what I do? Like there's
Yes.
this
Yes.
there's a definite stigma I can only
Mhm.
imagine.
Mhm.
And I had that with the gestational diabetes. And, you can only imagine as a patient too, this is something that like kind of once you get dinged with, you're like,
Mhm.
okay, what? I got to do what now? Like now
Yes.
I have to manage every
Yes.
day, every bite, every meal. Like it's a lot.
And so things have changed a lot with diabetes management. Even when I started over 10 years ago, we didn't have the medications, we didn't have the technology and everything that we do now. So a lot of times when people hear diabetes, they think, oh, I'm going to have to be on insulin therapy. I'm going to have to have my leg removed. My grandmother had her foot taken off. They think all those different things, but medications and advancements in diabetes has really improved. And so has the, I guess, the longevity of patients are living longer with diabetes. Diabetes can be well managed, So there's different aspects when you hear diabetes. A lot of people also, you have to think about their mental health, because when you hear that term diabetes, okay, you're thinking the worst. You're thinking, oh, my friends or my family are going to be around and say, well, I can't do this, I can't do that. And that's one thing that I also like when my patients come with their family members. I like to talk to the families and their loved ones as well, just to have that support.
That's good. That's really good. So what are the most important aspects of diabetes care that you think every NP student should be thinking about prior to going into practice? So say you're gearing up for your clinicals and you got a patient that you're like, oh, you pull the chart and you're like, this is diabetes management patient. What are some of the most important, maybe pick 2 important aspects of diabetes care that you want your NPs to be geared up for and ready for when they go in to see a patient?
Okay.
I know there's so many. Just pick 2.
I know. I guess, just knowing that every patient is different. So I don't know if this is part of it, but every patient is different and things need to be individualized. So not only do you want to look at numbers, when I mean by numbers of blood glucose and A1C levels, or looking at their CGM, that's the continuous glucose monitor, you also want to see how the patient feels. How they feeling? Are they having lows? How do they feel with these low blood sugars? Also, if you're looking at medical management, you want to see, like, what can you do together with your patients to make sure that they're going to take the medication that you prescribe. Because just say if you place a patient on some type of pill or something, or keep them on something that they say, this makes me feel bad, they're not going to take it. So work together with the patient to see what's going to be best for them. And that goes back to all patients are not the same. Make your plan individualized and listen to the patient. So I guess that would be the 2.
Yeah, that's great.
But with diabetes, again, you want to look at the whole picture. You want to look at their blood pressure. You want to look at their cholesterol. So it's so hard for me. I'm so sorry to just give 2.
You're good.
But you want to look at all those things, because we know with diabetes, patients are at increased risk of heart disease, kidney disease, also increased risk of blindness. And so you want to look at all those things and make sure that you're talking with your patient about those preventative care measures, like getting an eye exam once a year, getting a dental exam. And again, I can't stress enough, making sure that we're talking about their mental health as well, asking those questions.
Yeah, that's really good. And that could actually answer the second or the next question I have regarding challenges with diabetes care management, right? And that's a challenge because diabetes affects every organ system. It is it's a systemic disease, right? And so as much as you think you just need to focus in as the nurse practitioner on hemoglobin A1C, blood glucose, it's like, no, there's all these other things that you can be optimizing as their provider to help them. Vitamin D, calcium, seeing are they checking their feet, getting those eye exams, like you say. There's more things than just diet, just the blood sugar, right? And again, the deep dives that I've done, I actually wear a CGM. If you're on YouTube, you can actually see I have a CGM in, and I wear it because I have a 6-fold increase in diabetes because I've had gestational diabetes. And when you realize that every day, every meal, I'm either walking towards diabetes or I'm walking away from it. And so again, this is just something that I do that my patients are like, I've never heard of this CGM. And I'm like, no, man, this is a game changer. Like these guys don't want to prick their fingers. They're like, man, it hurts every time. And they've got neuropathy. And now you're asking them to poke their fingers with needles. And so I actually share in my current practice, I tell patients all about the glucose monitor. And I know, like you said, it's a game changer with these technologies that are walking onto the playing field that can really help us manage diabetes patients more effectively. And any more challenges that you notice with treating patients and how you overcome them in practice?
Well, a challenge that I could think off the top of my head is dealing with the insurance company. A lot of times they dictate what medications we could place patients on. And so that's a challenge. A challenge, you kind of already said, like the stigma. People have to live with other people, like judging them, or they living with the things of like, what did I do to get type 2 diabetes? And that's not necessarily the case. It's not anything that anyone has done. Sometimes family history plays a part in whatever chronic disease we may, get or whatever. That's the same thing with me. I've never had any type of heart issues or anything, but I have family history of heart issues. And so I got diagnosed with something with my heart. I never looked at it like, what did I do? So it's the same thing with diabetes. Sometimes the way that we even learn to eat, our culture, that plays a factor. If you do have something like high blood pressure, high cholesterol, that plays a factor in getting diabetes as well. So just overcoming challenges of other people and people with diabetes here, insurance companies, that's a challenge. And then sometimes patients may not be willing to accept that they have diabetes.
Yeah.
But again, that goes into talking with your patients, educating your patients, letting them know, hey, this is something that we can manage. You may have to take this medication. You may have to change how you eat. You may have to increase your physical activity. But those are all things that we can do together so we can decrease some of these possible risk factors. And I know that you had asked earlier about a day of managing diabetes, what that looks like. So I think, and even going back to Ms. I'll tie in with also the nurse practitioner that you said, students or so, like, what do you tell them to look for?
Yeah.
So all this kind of ties in. So if you have a patient that is at risk for kidney disease, you might want to place them on a medication that has, yes, a kidney protectant, something that's going to decrease their cardiorenal risk reduction. And so if you know the patient has heart failure, there's different medications that you can place the patient on. If you know that they've had a heart event or a family member and they're at increased risk, there's different medications that we know will help to prevent or delay certain things. If you have a patient that's overweight or obese or have obesity, then there's certain medications. So we look at all those things to just make sure that we're not saying, hey, I'm just going to throw this patient on metformin and glyburide, because I still have patients who come to me and their A1C may be 10 or 11, and their healthcare provider may still have them on metformin and glyburide. So that's what I mean by don't just place everyone in the same bucket. You need to individualize their plan. Diabetes isn't one size fit all. So I'm sorry if I got off on a different level.
That actually answered the next question, which is like deciding what drugs to put on a patient for diabetic care. You're basically saying, don't just focus in on the little tree of diabetes, focus in on the whole forest. Look at their cardiovascular, look at their renal, look at all the different factors, their creatinine, how they're processing, also, like you said, compliance. I mean, you pick a drug based on how compliant they are. Are they able to handle the side effects of the drug, right? I know metformin can just make you sick to your stomach. So some people can't tolerate it. They don't want to take it because they're just so sick. So you've got to be able to look at the whole patient, and that's the best way to pick medication. What about insulin? Insulin's this thing that like they use, they don't use. There's long acting, short acting. Kind of how do you manage that in the clinical setting? Because I feel like that's a whole separate beast as well.
It is. Let me say, so people with type 1 is an autoimmune condition. And so people with type 1 have to have insulin to survive. So we know for my type 1 patients, of course, they would be on a long acting and a short acting insulin therapy. Some may be on the insulin pump therapy. And then so patients with type 2, it may become a point where they may need insulin therapy. Just say they're on oral medications and oral medications are no longer being effective, or A1C at diagnosis is so elevated, so you may need to put on insulin therapy to get them where they need to be. So as far as long-acting, short-acting insulin, you have your basal insulin therapies, which try to act or mimic the pancreas, would give people a steady state of insulin throughout the day to help try to control or manage, your blood sugar. And then the bolus or short-acting insulin, that's what we give when patients eat, because normally what the pancreas will do when you eat, sugar is broken down. And so the pancreas is alert, say, hey, we need a little bit more insulin on board. So that's how we determine like the bolus amount or short-acting insulin. So there's various brands on the market. I have a few that I like that seem to work better. So that's kind of how I just judge that.
How you manage
also, depending on insurance, again, like I said, that's a challenge. So insurance may dictate, oh, well, this patient has to be on this certain insulin. But one thing that I will say with the different medications, especially like the GLP-1
I was
medications.
just about to ask you, is this the Ozempic craze or like, right?
Yes.
Isn't that
So
what's
yeah,
going on there?
so like the semaglutide, which is Ozempic, and tirzepatide, which is Mounjaro, those GLP-1s and Mounjaro is a GLP-1 and GIP. Those medications have really been game changers. So a lot of
Wow.
times patients who are on insulin therapy with my patients with type 2, once we get those medications like the Ozempic and Mounjaro, those medications tend to help so well with weight loss and decreasing what we call the postprandial after meal readings that we can take patients off of insulin therapy. So I've done that quite often in practice. So those medications are really game changers. Not only, the craze right now is weight loss, but they really do help people with diabetes. They have been game changers for sure.
Wow. And just for my own edification, what is their like mechanism of action? Like what are their pharmacokinetics? How are they working? Why are they such a game changer? I mean, like I heard everyone's like, she must be on Ozempic. She looks so good. Like it's now like a thing, right? So like
Yeah.
what is it? What is it doing? Do I need some? Like what is it?
So as far as with the weight loss, so it helps you to feel full. So it tells your brain that you're full. So people tend to eat less. And a lot of times people with diabetes don't have a lot of incretin or gut hormones. So it replaces that. So most of the time people with diabetes tend to stay hungry all the time. So this is helping that. And so far as with the weight loss, again, if it's telling you that you're full, so you're going to eat less, and then you're getting this gut hormone replaced, you're not going to want to eat. And so that's what's happening with the weight loss crave. So you don't want to eat, you don't have the appetite to eat. And then if you overeat, since it's telling you that you're full, you kind of get nauseated. And so you're going to say, hey, I'm not eating this for sure,
Yeah.
So it's been a game changer. And, now FDA has approved like Wegovy, which is semaglutide, and also Zepbound. I always say that incorrectly.
Yeah.
Zepbound, which is tirzepatide. So, and I think that's great because at one point people were getting like these medications that needed to be for people with diabetes for weight loss. And, that was upsetting to me because I'm like, my patients with diabetes need these medications. So now that the FDA has approved for obesity management, it's going to be good all the way around because if we're treating obesity, we're decreasing the risk of diabetes,
Yes.
we're decreasing the risk of heart disease. And so these medications I've been reading different articles about helping with liver issues, helping with dementia. So these medications are really a game changer here to stay. So I'm happy about that.
Yeah, me too. I've heard a lot of people having Ozempic babies. That's another thing, is that like it's helping with infertility because
Yep.
infertility is really tied to
Mhm.
glucose control, insulin resistance. These things are actually it's all connected. You know,
It's
that
all
graph of the guy
connected.
that's like, it's all connected. It is all connected
It
between,
is.
insulin resistance and fertility and your health and wellness and your brain, and Alzheimer's disease is type 3 diabetes, and PCOS is diabetes of the ovaries. And so there are all these
Yep.
things where like, again, there's so much in this field of
Yep.
diabetes management that you could even niche down even more if you wanted to as a provider, which I think is a great opportunity for nurse practitioners to hear. If you're interested in this at all, you could just niche down and do a very specialized practice where you only do these things. And there is enough in this field to take care of everybody, and there's enough work to go around. So don't feel like, if you step into this, you're like, oh, I'm going to be taken away. Nah, there's enough work. Don't worry.
There's enough
right?
people with diabetes too, for sure.
Exactly. And so staying up to date on all the resources, all the things that you have to do as a nurse practitioner in diabetes care is tough. So how do you incorporate that into your practice as a diabetes focused nurse practitioner? How do you stay up to date?
Well, the thing about it, I love diabetes. I love taking care of patients with diabetes. I love educating people with diabetes, patients, community, and all. So I want to stay abreast. I want to know the latest things. And so I go to our conferences. I'm a part of the American Diabetes Association. I'm actually on the advisory board for our Women's Interventional Network for the American Diabetes Association. So I go to our conferences. We also have an Institute of Learning. And that's for healthcare providers. And I believe it's free. I know it's free if you're a member, but I think they do have some free CEUs. So that's a good resource, American Diabetes Association. We have our standards of medical care that come out every year. And I'm like, big geek or nerd or so excited when that comes out. I'm like, hey, let's see the new things for that. Also there are resources with the Association of Diabetes Care and Education Specialists. That's a good resource for patients. But I'm sorry, for providers, excuse me. I remember when I was in nurse practitioner school, one of my instructors, I loved her. She used to always say, you could be a provider, you could be a nurse practitioner, but be a nurse practitioner, whatever, you're going to have to go to conference. You're going to have to stay up to date. You're going to have to, do these CEUs and pay attention to. And so that kind of stuck with me. I know a lot of nurse practitioners don't like going to conferences or whatever reason, but that's how you can stay abreast on things.
Yeah, that's really good. Yeah, that's good. Okay, so kind of shifting back to career development and the nurse practitioner. And if you had to reach out to an NP student who wanted to specialize in diabetes care or pursue advanced practice in endocrinology, what do you think are some of the skills or advice that you would give him or her as they're pursuing diabetes care? What are some things that you're like, this is important to, if you're wanting to go into this field, to be, knowledgeable of and understand?
Yeah. Just knowing like those standards of care in diabetes. And so that's something that you can easily refer to or even look up with the ADA, knowing.
You're talking about like clinical practice guidelines, right? So knowing kind of those beautiful charts that break down, okay, if then this, remove this, they kind of break it down that way. Is it algorithms?
Kind of, sort of. So there is an algorithm like for management of type 2, there's an algorithm for insulin therapy and everything. But again, those are just, there are guidelines. So there's things that you need to be aware of. But at the same time, you also want to, again, make sure that you are individualized, personalized care. So you want to make sure that you are, the normal things, listening to your patient, doing a physical exam, know how to do monofilament testing, looking at labs. So I don't think it's anything that just necessarily would set you apart from what you already know as a nurse practitioner, except for just kind of specializing in diabetes. So when I decided to really go for diabetes, I took again, it was then the CDE. Now it's the Diabetes Care and Education Specialist exam. So I just started studying different things, looking up. I went to a course, Diabetes Education Services, Beverly Tomazian. She has a course for diabetes educators. And so I listen to her even now, and now we have a relationship. I'm like, I remember, yes. And
that's so cool.
Yeah, it was so great. I met her, and she was like, yeah, I follow you and proud of you. I was like, oh my God. But I listen to her, even now. And so that's really good for any nurse practitioner that wants to get into diabetes. You can go to like a conference, ADA, the ACE, they even have a conference or so. So just really just honing in on diabetes care, like looking up what things you need to do, knowing how the pancreas works, knowing the reason how medications work. So you could tell and then also give them possible side effects, tell them how the medication is possibly going to affect them, those different things. I don't think it's anything necessarily different, but just studying diabetes, knowing it.
Yeah, that's really good. I like that a lot. Being well-versed and well-educated allows your patients to be well-informed and also motivated to feel like they have somebody in their corner. So the better educated you are, the more that you're able to assess your patients, and you're able to help them feel like the decisions that they're making are in their best interest, and they'll stick with them when they know they have somebody fighting for them in their corner.
Especially like that you care. So if you're taking that extra step to tell them like, XYZ, like this is how this works. If you have any issues, make sure you call me, and then working again, just telling them like, I would feel better if we would do this once a week injection. Well, I'm so nervous about injections. Okay, well, let's see, we'll do the first injection in the office and you tell me how you feel. Those things. So again, you're working with your patient. So you're just not saying, this is what you're going to do when you walking out the door. No. We need, as providers, we need to talk to our patients and we need to tell them. That's how you gain their trust. And once you gain their trust, they're with you for life. Like I have patients, even from that practice that I was at before, that have come to West Memphis. They come see me. I have a lot of patients from Memphis that have been with me for 10 years. So once they feel like you care, and you really do need to care, don't just make them
don't
feel
fake
like
it.
you care. Really care.
Yeah.
you have a patient, and then they tell their friends, they tell their families. I have people that come to my office, and I'll say, well, how did you hear about the office? Because I'm still, building my practice. Oh, I was in Walmart, and this couple was talking about you. I was like, okay, great. Those are the type of things that you want.
That's
You
cool.
want patients to feel comfortable. You want them to know that you care.
Tell me another story, because I love on your Instagram how you post how you've dropped people's hemoglobin A1Cs. I mean, it's
How they drop their
awesome.
A1Cs.
Yes, correction, how they dropped it with your help. And so you shout them out on your Instagram, and it is so incredible. So tell me some of the stories. I mean, there's got to be that little lady that was like, I will never. And then now you've got her doing whatever. And,
There's plenty of those. To be honest, I'll never. And now I have one in particular. I think her A1C, this was one of the patients we did last year. Her A1C might have been like 10 or something like that. She's been with me now 2 years. And so her A1C has been under 6 for forever now. And so, well, not forever, but she's been with me. Yeah. So now she calls me her sugar angel. I just love her. I love her. And so with those things, so I started last year doing, like, we did it for November. And so then I had patients coming in and was like, I want to be one of your Facebook posts or whatever. And so I was like, okay, well, I'm going to do it monthly. But doing your business and like the provider part, I love it. But when you have your own business, you have to do the management aspect. And so I was like, I really can't do this once a month unless, somebody else is doing it. So I was taking pictures, but then I was like, okay, we're still just going to do it for November. So, but I think my patients want me to do something like once a month. So I probably will try to do that. But it's a lot, guys. It's a lot trying to own your own business, see patients and all that, because they teach us in school how to provide care. They don't teach us the business side. So that's a whole nother beast in itself. But like one other patient in particular, her A1C was like above 14. So and so now she's been under 7. She had kidney issues. So when she first came to me, she had protein in the urine, GFR was low. I put her on a medication that helps decrease the protein in your urine, also increases kidney function and everything. So her kidney functions are better. She's lost so much weight, and she's young. She is probably like 40 or so, 39, something around that. And so she's
we're seeing this, great. Right? More and more younger people with terrible disease.
Yes. And so like, I'm so proud of her. I'm proud of all my patients. And so like, it just it makes me feel really good when they're doing good. And to me, I think I like a challenge. So I like when patients A1C are like 16 or whatever. I'm like, come on, let's try to tackle this together.
Yeah,
so that's a good and bad thing. I like challenges in my life too. So I think that's good and bad.
But I think it's really neat that you were able to see how just by changing that one number, you're changing their life. Everything begins to kind of follow that number. And as you bring those numbers down, everything in the body starts to, kind of reverse itself. And so that's very rewarding from a treatment standpoint, a career standpoint, owning your own business and taking care of those patients. It's very, very rewarding. And then for the future of diabetes, these CGMs are now over the counter. Dexcom Stelo, I think it's Libre Rio is now over the counter. You don't have to get a prescription. That's the thing. A lot of my patients are like, but my doctor won't give me a prescription for that. And I'm like, you don't need a doctor. Just tell him you can get it over the counter now. And so I'm so about CGMs. What more do you see coming down the pipeline for diabetes care and diabetes management that a nurse practitioner student would love to know is cutting edge, is new?
So some new things that we learned at ADA here recently, well, even before our last scientific session, they're looking at trying to have the first once a week insulin. And so that's something that the FDA, they're trying to get approved for FDA now, once a week insulin therapy, especially with type 1. Now we're doing more and more type 1 screening, because we're trying to get those people who may be at risk and go ahead and try to maybe delay type 1 from occurring. And those extra couple of years or so could be really awesome for a mother who knows their child is highly likely going to develop type 1. So you're going ahead now and getting education and knowing the signs, symptoms of things you may need to look for. So that's a big thing that's going on now, the type 1 screening. And then also, again, trying to do the once a week insulin injections. And then there's different treatment options that will be coming out with the GLP-1s and GIP medications as well.
Interesting, the genetic testing to see if you will develop type 1 down the road. I was actually speaking to a family friend that had said she'd actually developed type 1 after a viral infection. So she was older and had a viral infection, COVID, one of these ones that just kind of ran through. She did fine, but her pancreas didn't pull through the infection. And I know also they're saying the Coxsackie virus is another one that they're actually linking now to type 1 diabetes. And so I think there's going to be a lot of talk, I don't know, I'm just, guessing about the viral component behind developing type 1 diabetes. Why does that happen? I've always been very curious as to the immune system and how it kind of panics and then attacks your own organs. It's very, very interesting. And for your practice, do you see patients in person or do you also do telemedicine?
Well, I see patients in person. I just recently hired someone to help me improve the office and getting more policies and all that. Yeah, I needed it. I needed that piece, and now I feel a relief. And so she was like, okay, we're going to start doing telehealth too. I was like, okay, all right, taking me too fast. But so, yeah,
That's
I plan
good.
to do telehealth too. So, yeah, I just did that. She's been a lifesaver too. It's been,
She's just helping you optimize systems. Yeah,
and getting things in order for the practice.
That's so good. Good for you.
Yeah.
Nykkia, this is awesome. So for the final part of the podcast, again, please just share any advice that you have for an NP student that's interested in starting out in diabetes medicine or is starting a clinical practice with a preceptor in diabetes management. Share that last piece of advice with my listeners.
So if you want to go into diabetes, I say do it. We need more providers, especially providers that care. And if you want to be a diabetes educator or certified diabetes care and education specialist, do that as well because you are needed. And so I would say for anyone who is thinking about, going into your own practice and you do have like a preceptor, you have someone like a mentor, so soak up all the information, soak up all the knowledge you can. Don't think that, oh, I don't need to know this or this person can't tell me. They can. So you still make it your own, but listen, that person may not have all the things together like I don't. Like I just said, I just hired someone to help me. And so again, but don't be afraid to step out. And don't be too bullheaded not to listen. Soak up all the information. Go to conferences. And if you are in where you work now, if they would pay for you to go back to school, they pay for you to do any kind of certifications, do that. Do that.
Yeah, that's really good.
But go for it.
I love that. Go forth, check out diabetes care, and we're going to do rapid fire. And then we're going to tell people where they can find you. Are you ready for rapid fire? Are you ready?
I guess so.
Okay, get ready, girl. If you could pick an actress to play you on TV, who would it be?
Sanaa Lathan, I don't know.
Oh, I don't even know who that is. What did she play?
She was in Love and Basketball. I just like her.
I know who that is. Oh my gosh,
I just like her. I just couldn't think of anybody.
Yeah, she's cute. And then if you have a book to give to somebody, what book would it be?
The Bible.
Oh, the Bible. That's a good one, girl. Yes, that's good. It's a rapid fire. You're not supposed to know. You're supposed to be able to just... And then I have another question. What's the very first concert you ever attended? The very first concert.
Crisscross.
Let's make you jump. Man, we going back, girl. Taking it to the 99.
Yes, Crisscross.
Oh my God, I'm so glad I asked that one. Okay, so for the Success MP quote of the episode, action is the foundational key to all success. Pablo Picasso, take action today. Do it. Start now. You'll be happier with yourself years later. That's Sandra's addition to that quote. So, guys, thanks for coming on to the podcast today, Nykkia. Tell people where they can find you and they can check you out on your cool Instagram page.
Well, I am on Instagram and Facebook. I think the Instagram is the Diabetes Wellness NP. Then our Diabetes Care and Wellness, we're at My DC Wellness. And I'm also on LinkedIn, Nykkia Sellers, especially any nurse practitioners or nurse practitioner students or anyone interested in knowing more about diabetes or becoming certified or anything. You can reach out to me there. And Facebook, I think it's Diabetes Wellness NP as well.
Yeah. Guys, check her out. Look what she's doing with her own practice. And yes, something that she has created out of this sickness, illness that she had. She experienced something. She spent some time with herself and this kind of surfaced up, which is really, really cool. And something that I hear reflected in a lot of people's journeys as they create their own things. It's always built out of a pivotal point, an inflection point that just makes you go, I'm not doing that anymore. And you changed the trajectory of your life. So thank you for coming on and sharing with our
I
audience
enjoyed it.
your journey. Thank
I
you so
enjoyed
much.
it.
All
Thank
right,
you.
guys. Thanks for hanging out.